Dr. Osterberg, tell us a few things about headaches and how maybe a twisted spine or a overused muscle somewhere in the body can cause headaches, and what can a person do to eliminate, to find out that maybe it is something like that, and then fix it, eliminate, and do some preventive actions towards it.
Sure. Headaches are a great topic. We see a lot of headaches in our office, and headaches can be challenging cases because there are so many different causes. Stress can cause them. Poor posture, where somebody slouches and pushes their head forward a few inches. It increases muscle tension in their neck, and that can cause headaches. They can get headaches from not enough sleep. We can get headaches from caffeine or from nicotine or from other medications that we're taking. We can get headaches from hormone changes. You can get headaches from seasonal allergies. I mean, there's so many things. Even allergies to foods can cause headaches. So sometimes you have to weed out those cases and figure out which ones are caused by what. But in general, we get very good success with headaches in a chiropractic office. And when I say with chiropractic treatment, it's with a combination of spinal manipulation as well as some exercises involving stretches and posture and sometimes some massage therapy as well. But we have a 73% success rate with patients with headaches, of either migraine headaches or tension type headaches. A typical treatment plan for people with headaches is about 4 to 5 weeks. And, of course, there's going to be exercises involved. All of them have to do some sort of exercises to increase flexibility and to work on their posture at home.
I see. All right. Wonderful. So there's hope for it. There's hope for headaches. There always is some cause, right? There's always something which in the body is not quite right, and it's just a matter of
There's
finding
always
it.
a cause.
Yeah.
Absolutely. There's always a cause. And occasionally we can help 73% of the people, but there's still 27% that don't get great results. And then we need to get them off to the right provider and find out, is it a food allergy? Is it a medication? Is it stress or anxiety? Is there something else going on? But we tend to try the simple things first when they come to us. If there's a problem there to treat, we'll treat that. And it's been working out very well.
So how many people come to you with a headache and you find as the cause a Tylenol and aspirin deficiency?
Not very many. I mean, certainly that's how Americans tend to manage headaches. And, maybe that's okay if you only get a headache once or twice a year or on very rare occasions. But those medications can be helpful, but they do have side effects, and they can be dangerous if somebody's taking them, 3-4 days a week over and over and over. We want to try to find out what's really going on and help fix the problem.
Like I sometimes, I think somebody told me, let's just say you have a toothache, and yes, as you just mentioned, to take an aspirin or something like that till you can get your butt into a dental office over the weekend or, on Monday or so, that may be a good solution. But then you do, because if you keep taking those aspirins again, it doesn't mean that your infection in your tooth is stopping. It just means you don't feel the pain.
Right.
So if you keep taking it, your tooth will explode one day for sure. One way or the other way, it will really, and you may be having no pain. I mean, after all, you could go and get you can die while being under anesthesia. They can do all kinds of things to you and you don't feel pain. And that would be it. So if you mask it up with a tablet, you just simply don't cure the cause. And as you said, if it's something because you have it every so often, once or twice a year, no big deal. Maybe it was a food allergy. It goes away. You mask the pain. You're fine. Just for the fact that you're fine afterwards means you're fine. And the aspirin didn't cure anything. It just got you through the time while something wasn't right in the body.
Absolutely.
But if that comes reoccurring, there simply is something else. Out-of-line nerves, food allergy, something is going on. Dehydrated maybe, or whatever it may be.
Sure. There are many times patients will come to us with headache problems, and as we're finding out their case history, it's been going on for 10 years, and they've been taking 6 or 8 ibuprofen every day for years at a time. And that's when I get concerned, because the side effects of the over-the-counter medications, when they're misused, can be really dangerous for people. And so, those sort of people, it's a lot of job satisfaction when we can help them out and they can get off of the medication.
Thanks a lot, Dr. Osterberg.